anatomy. So after a long time, I'm to this session and I'm lining to make a live session about anatomy of the lower limbs. So stay tuned with me. How to know about the lower limb. So here in this video, I'm going to introduce you to the lower limbs. I'm going to say what are the bones we have, what are the joints forming the lower limb, and then I will give you a brief discussion about the hip bone. So till then, stay tuned with me. So today, let's see, we have the human body. So our human body has the axial skeleton. This axial skeleton, if you see, I'm very bad in diagram. It comprises of the upper limb. So these are the upper limb. We have the rib cage, the vertebral column, ribs, sternum, vertebral column. So they are forming, all the things are forming axial skeleton. Now, after this, we get our lower limbs. This is our lower limb. So how this is connected? This is connected by a bone. And this bone is very important to us. This is none but the pelvic bone or hip bone. So now the question comes here is, who are forming our lower limb? So when we talk about the lower limb, that is something which is below, lower limb. So this lower limb is formed by the pelvic girdle. So this pelvic girdle, what does it does? It attaches the axial skeleton to the lower limb. Now, when we talk about the lower limb, let's have a look on the bones. So what are the bones we will form from top? First, we will get the femur. After femur, we have the knee cap, which is formed by the patella. After this, we have the tibia, we have the fibula, and the foot complex bones. So now, what are the number of femur we have? We have two femur, one for right, another for the left. We have two patella, we have two tibia, we have two fibula, and the foot complex is comprising of the tarsals, metatarsals, and phalanges. So the tarsal comprises of 7 plus 7, we have 14. Metatarsal 5 plus 5, total 10. And phalanges 14 plus 14, 28 for the lower limbs. Same phalanges we have for the upper limb. So total number of phalanges, again I'm saying you, we have is 56. So this is the number of bones which will come in the lower limb. And this is very, very important when it is to the viva. So in total, how many bones we have? We have, including the hip, we have total 62 bones in the lower limb. Now, let's divide the regions. If we have the femur will be in the thigh region. So this is the region which is the thigh region of femur. The kneecap patella will form the knee region. When we have the tibia and the fibula both together, we'll get the leg region. And the tarsal, metatarsal, all this we will have in our foot region. So what are the regions we have? We have the thigh region, which is formed by the femur bone. We have the kneecap, which is formed by the knee region, patella, the largest sesamoid bone of the body. Which is the largest sesamoid bone? The first largest sesamoid bone is the sesamoid bone. The first largest sesamoid bone is the patella. Next, we have the tibia and fibula, which is forming the leg region. Next, the foot complex is formed by this is tarsal, metatarsal, and phalanges we have in the foot region. So, one thing you should keep in mind, there can be a question. What is the difference between tarsal bone and carpal bone? Tarsals are found in the foot. Carpals, same way, will be found in the hand complex. So carpal are the bones of hand complex, tarsal are the bones of foot complex. Tarsal are 7 in number, or carpals are 8 in number. So this thing, now let's know about the joint. First, we have started with what? Pelvic region. So pelvic region, what we have? We have the hip bone. So here we will get the following joints. Number 1, pubic symphysis. I'll come later on. Next, we will have the sacroiliac. Next, we will have the hip joint. The other name of hip joint is acetabulofemoral joint. Is it clear? So this will be formed within the pelvic region. When we come to the thigh, superiorly, we have the hip joint. Inferiorly, we get the knee complex, that is the knee joint. Or why it is called as complex? Because it is formed by 2 or more bones. Next, in the leg region, we have the superiorly, we have the knee joint. Next, with tibia and fibula, we have superior tibio-fibular joint. Inferiorly, inferior tibio-fibular joint, and we have the ankle joint. Then in the foot region, most common joints, we get the intertarsal joints. What is intertarsal? It means among the tarsal, like tarsocalcaneal, calcaneonavicular, like this type of joints we will get. So I'm not discussing all the names. Then we have tarsometatarsal joint. Then we have metatarsophalangeal joint. So let me say now, when we are in the pelvic region, pubic symphysis, it is formed by both hip. Sacroiliac joint between sacrum and ilium bone of hip. Hip joint, it articulates with the femur, acetabulum plus femur. Next, the knee complex is formed by femur, lower end, patella, and tibia, upper end. Next, superior tibiofibular joint, it is formed by tibia and fibula. Inferior, same, tibia, fibula. And ankle joint by tarsal, that is talus. We have a bone of tarsal, talus. Lower end of tibia and fibula, lower end. They are forming the ankle joint. So ankle joint is formed by talus, lower end of tibia and fibula. The foot complex is formed by the intertarsal joint, metatarsal joint, and tarsometatarsal. So intertarsal means among the tarsal bones. Tarsometatarsal means tarsal and metatarsal bones. Metatarso-phalangeal joint means between the metatarsal and the phalangeal joints. And finally, we have the interphalangeal joints. So that is in brief about the lower limb overview and structure. So next, let's move on to the hip. So hip, if we talk about the hip bone, it is a flat, irregular shaped bone. It is located laterally to the body. We have two number of hip, right hip and left hip. And when we talk about the hip, this is a bone of the pelvic region. Which region? Pelvic region. Next thing is we have this bone is also called as innominate bone. The other name of the bone is very important question, innominate. INMONIT, innominate bone. So, if we look at the structure of the hip bone, this is somewhat like this. I'm just giving an overview. Okay. Now you see, when we see this bone in the pediatric, this entire bone before 15 to 17 years in pediatric, this bone is like this. Means our hip bone in the pediatric is divided into three small parts and is joined to each other in after 17 years. When there is an ossification, it forms a single bone. And what is the cartilage? It will be having a cartilage which will join this three area, and this is called as the triradiate cartilage. This is a triradiate cartilage. Okay, so in pediatric, within 15 to 17 years, 15 to 17 years before, if you take an X-ray, you will see three bones. After this, it fuse, and in between them, we have a cartilage which is called as a triradiate cartilage. Now, let's come to here. The hip bone comprises of three parts. The largest, widest, and longest is the ilium. So this is the ilium part. This after the ilium, so where the ilium lies, it lies superior anteriorly. Next, we have the ischium. This portion is the ischium. Where does it lies? It lies inferior posteriorly. After this, we have the pubis. How where it lies? It lies inferior anteriorly. So this will be the pubic bone. Now come back. When we talk about the ilium, I'll make a diagram. The ilium bone itself has three surfaces. So I'm putting here a line diagram to make you easy. It has three surfaces. The three surfaces are anteriorly we have the iliac fossa. So this will be the iliac fossa. Or in then posteriorly we get the gluteal surface, and middle when it attached with the sacrum we get the medial surface. Now similarly, if you see the ilium, we can see there is a superior margin, very prominent margin. So this margin is known as the iliac crest. So it has a iliac crest. Okay, this is the iliac crest, and the highest point of the iliac crest is the demarcation of L4 vertebra. After the iliac crest, we have four spines, two anteriorly and two posteriorly. We have the anterior superior iliac spine, we have anterior inferior iliac spine, we have posterior superior iliac spine, and posterior inferior iliac spine. So if it is the anterior, this is the anterior superior iliac spine, ASIS. We have anterior inferior iliac spine just below it. Posteriorly, we have posterior superior iliac spine, posterior inferior iliac spine. Now, when we move to the back side, posterior side, posteriorly, we get two notches like this. The two notches. The first one is called as the greater sciatic notch, and the second one is the laser sciatic, SCAITIC, sciatic. Why these are called as greater sciatic and lesser sciatic? Because through this area our sciatic nerve passes. Greater because This area looks great. Laser, this area is small. Sciatic, so these sciatic nerves are passing. So there are two notches. What are notches? These are the depressed areas, depressions. So greater sciatic, lesser sciatic. So whenever you learn anything, you should have a why. Why it is called spine? Because these are having sharp projections. Now, in between the greater and lesser sciatic notch, we have again a spine, and this spine is known as the ischial spine. So, let me repeat. When we take the ilium bone, if it is an ilium bone in exam coming, it is the widest and longest part of the hip bone, that is the pelvic bone. It is located superior anteriorly. Next, you will talk about the surfaces. It has three surfaces. The first inner internal surface is called as iliac fossa because it looks like as a basin curve shape. Iliac fossa is concave. Then we have the posterior external surface, that is the gluteal surface. Next, we have the medial surface where the sacrum bone will get attached somewhere this type, rough area. Next, we have the iliac crest, the highest superior margin. The highest point, that is the midpoint, marks the L4 vertebra. Next, we have four spines: anterior superior, anterior inferior, posterior inferior. Next, we have the posteriorly, we have two notches: greater sciatic notch, lesser sciatic notch. In between the greater and lesser, we have the ischial spine. Now, let's talk about the ischium. So, when we look at the posterior side, we get like this way one bone is coming, and this bone is none but our ischium. So, ischium. So, what is the location of the ischium? It lies inferior and posteriorly. Now, what are the things as we have in the ischium? We have the body of ischium. We have two ramus, superior. Another one is the inferior ramus. And finally, the most important structure, the most important area for the fracture is the ischial tuberosity, a round circular depression area. So, this area, the last point, we can say, lowest point of the ischial bone is the ischial tuberosity. This area is the inferior ramus, which connects with the pubic bone, inferior ramus, this inferiorly, and this one is the superior ramus, or you can say ischial ramus also. Superior ramus, it connects with the ilium. So ramus is what? It's a junction which is connecting. So this bone is connecting like this. Like this, it is going to connect. This is the bone. Okay, and this is the body. After this thing, let's we have another part, that is the pubis. So pubis, where it is located? It is located inferior anteriorly. Now you see, I'll just draw the lower portion. So this is how this bone looks. If you join the two hip bones, in between this you will get a joint, and this joint is the pubic symphysis. Okay, so this is a joint which is called as the pubic symphysis. Now, what are the ischium has? It has a body, and it also has two ramus. The two ramus, the superior and inferior. Okay, so this is the body, and this is the superior ramus which is connecting, and this is the inferior ramus. The superior ramus will be connecting with the ilium, and inferior ramus will connect with the ischium. Additionally, now you see the junction of all the ramus of ischium, pubic, and ilium, they form a circular opening. So this circular opening is known as the, so another part of our hip bone. This circular opening is known as the obturator foramen. So this is the largest foramen of the human body. So this is the largest foramen of the human body, known as the obturator foramen. What are the structures passing through here? Nerves, blood vessels, then lymphoid tissues, all these things, structures will pass through this area. Artery, vein, very important area. And just above the acetabulum, we get, I'll show you here, a half moon structure like this, a half moon cup shape, vinegar shaped structure, where our head of the head of femur gets attached, and this area is known as the acetabulum. So we have another structure, that is the acetabulum. So it is a articular surface. Okay, middle surface is the articular surface. It forms the SI joint. This one forms the hip joint, and the pubic symphysis is the articular surface. This forms the pubic symphysis. So this is all about the hip bone. Next, if you see the hip bone, what are the joints we get? Itself, it has the sacroiliac joint, it has the hip joint, it has the pubic symphysis. Additionally, along with this, in the hip pelvic area, we get the lumbosacral forming with L5, lumbosacral joint, fifth lumbosacral joint additionally, and we get the sacrococcygeal joints. Okay. So the pubic symphysis is a cartilaginous joint. It will not have that much movement. Slight movements are there. Sacroiliac joint also, it's a fixed type, so it will have slight movement anterior and forward. The hip joint will have the maximum movements. It has the flexion. It's a ball and socket joint. It has the extension. It has the abduction, adduction, flexion, extension, abduction, adduction. Next, it has the medial rotation, lateral rotation, and circumduction. So this all other movements it will be possible. So this is all in brief about the hip joint. If you have any problems, you can put in the comment section, and I will give you in the overview in details. So till then, thank you. Stay with us. Stay with RU. The video sections, you will get all the educative sessions. I have made the playlist. You can go by the playlist. So I am very much expertised in radiology, and I'm just teaching the anatomy. So I'm just giving you an overview of the anatomies. So with all these things, if you have any problems regarding radiology and anatomy, you can put it to me. And the next important thing is, if you want any more sessions, topics, you put in the comment section. I'll just come back to you soon.